All right, to take a blood pressure, you want to expose the patient's arm. You want to find a blood pressure cuff that is the right size. To size it, you want to make sure that the blood pressure cuff takes up 60 to 80% of the upper arm. When you place it, you want to place it as tight as you can get it. It will give you the best reading. It will give you the best reading by doing that. Okay, once that's on, the gauge is detachable, which is why it has this long tube attached to it. So in case you can't see it once you put the gauge on, you can pull it out and then inflate to be able to see it. In this case, I'm able to see it and place it there. What I'll do a lot of times, especially if the cuff kind of rolls over it like this, I'll tuck the cuff or the edge of the cuff like that so I'm able to see the gauge. So the next thing you want to do is find the brachial pulse. Remember, it's in the break of the arm, and it's on the medial side, which is the side closest to the body. So you want to find that brachial pulse. And once you do, that's where you want to place your stethoscope, directly over that brachial pulse. Okay? And I'll put the stethoscope in my ears. Now, you want to support the patient's arm at the level of the heart. Make sure the stethoscope is laying on the skin directly over the brachial artery. On your inflation bulb, there's a knob. You turn it to the right to tighten that knob up. Once the knob's up, you want to inflate by squeezing, and you continue to do that until the blood pressure, I generally say start at 180. See if once you get to 180 on the pressure gauge, see if you can hear the heartbeat. If you can hear the heartbeat, you need to go higher. If you can't, which I don't hear anything, so I'm going to start coming down. You want to come down slowly, deflate it by twisting, and control that needle. And what you're doing is you're listening for the heart. So when you hear the heart beating, the very first number, when you hear that heartbeat, that's your top number. And continue to go until you stop hearing the heart. Wherever the needle is when you stop hearing the heart, that's going to be your bottom number, which is your diastolic. Your systolic is your top number, diastolic is the bottom number. And her pressure is 110/70. I started hearing the heart beat at 110. I stopped hearing it at 70. So that's her blood pressure, 110/70. Another thing that you can do with your blood pressure cuff when you're deflating it, you can watch the needle. Sometimes you'll see the needle starting to bump. And when you start seeing the needle bump, you should start hearing the heartbeat somewhere close to that. That's another indicator of where your blood pressure is.